client's WBC count is within normal range and does not warrant intervention from the clinic nurse. 3. The normal serum potassium level is 3.5 to 5.5 milliequivalent/L. This client's level is within normal range and does not warrant intervention from the clinic nurse. 4. The normal serum sodium level is 135 to 145 milliequivalent/L. This client's level is within the normal range, and the client does not warrant intervention from the clinic nurse. Answers 98. Prioritization, delegation, and management of care for the NCLEX-RN registered exam content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, assessment, client needs, safe and effective care environment, safety and infection control. Cognitive level, analysis. Making nursing decisions, the nurse must be knowledgeable of normal laboratory values. These values must be memorized and the nurse must be able to determine if the laboratory value is normal for the client's disease process or medications the client is taking. 33. 1. In the Hispanic culture, the husband often speaks for the wife and family, and requesting the husband not to speak may be insulting. This action may cause the wife to leave as well. 2. In the Hispanic culture, the husband often is the spokesperson and makes decisions for the wife and family. Asking the husband to leave the room may cause the client to leave as well. 3. This behavior may be cultural, and the nurse should continue to allow the husband to answer the questions, while the nurse looks at the client. The nurse must be respectful of the client's culture. The nurse can, however, ask whether the client agrees with the husband's answers. 4. This is disrespectful to the client's culture. Many times the nurse must honor the client's culture while caring for the client. Content, management of care, category of health alteration, respiratory, integrated processes, nursing process, evaluation, client needs, physiological integrity, basic care and comfort, cognitive level, analysis. Making nursing decisions, the NCLEX-RN registered blueprint includes nursing care address. Seeing cultural diversity. The nurse needs to be aware of cultural differences. 34. Correct answer, 3, 4, 1, 5, 2, 3. The nurse needs to determine if the client is unresponsive prior to taking any action. If the client is unresponsive, then perform compressions. 4. The American Heart Association recommends 30 compressions followed by 2 breaths. 1. After completing compressions, open the client's airway to ensure a patent airway. 5. The nurse should then administer 2 breaths while the client's nose is pinched. 2. The nurse then must determine whether the client's heart is pumping by checking the carotid pulse. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, analysis. Making nursing decisions, this is an alternate type of question included in the NCLEX-RN registered blueprint. The nurse must be able to perform skills in the correct order. 35.1. The client with end-stage COPD usually prefers a cool climate, with fans to help ease breathing. A warm area would increase the effort the client would require to breathe. This action would warrant intervention by the nurse. 2. The client with end-stage COPD should be maintained on a low oxygen rate, such as 2L/min to prevent depression of the hypoxic drive. High levels of oxygen will depress the client's ability to breathe. This action would not warrant intervention by the nurse. 3. The client will usually sit in the orthopneic position, usually slumped over a bedside table, to help ease breathing. This is called the 3-point stance. This action would not warrant intervention by the nurse. 4. The client in end-stage COPD has great difficulty breathing, therefore, sleeping in a recliner is sometimes the only way the client can sleep. This action would not warrant intervention by the nurse. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The nurse only delegates tasks in which the UAP has been trained to perform. Delegation means the nurse is responsible for the UAP's actions, therefore, the nurse must evaluate the UAP's understanding of the procedure the UAP is asked to perform. 36.1. The UAP cannot perform sterile dressing changes. 2. The UAP cannot perform sterile procedures. 3. The UAP cannot teach the client. 4. The UAP can transfer the client from the bed to the chair 3 times a day. Content, management of care, category of health alteration, respiratory, integrated processes, nursing process, planning client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The nurse cannot delegate assessment, evaluation, teaching, medications, or an unstable client to a UAP. 37.1. The staff member is violating HIPAA, and the nurse should take action immediately. Chapter 4 Respiratory Management 99.2. The nurse should first ask the staff member not to discuss the client with a friend. Discussing any information about a client is a violation of HIPAA. 3. The nurse should address the staff member in the restaurant. The nurse could tell the clinical manager, but the nurse must stop the conversation in the restaurant immediately. 4. The nurse should not tell the client about the breach of confidentiality. Content, management of care, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. There will be management questions on the NCLEX-RN registered. In many instances, there is no test-taking strategy. The nurse must be knowledgeable of management issues. The Health Insurance Portability and Accountability Act, HIPAA, passed into law in 1996 to standardize exchange of information between healthcare providers and to ensure patient record confidentiality. 38.1. This statement warrants intervention because fluids will help prevent dehydration and renal calculi. The nurse should explain the client needs to increase fluids. 2. ROM exercises help prevent deep vein thrombosis, DVT. This statement does not require intervention by the nurse. The UAP can perform skills if taught and performance is evaluated by the nurse. 3. Keeping the client off the buttocks is an appropriate intervention for a client on strict bed rest. This comment does not require intervention by the nurse. 4. Pulling the client across the sheets will cause skin breakdown. Because the UAP is not doing this, no intervention by the nurse is needed. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. Delegation means the nurse is responsible for the UAP's actions and performance. The nurse must correct the UAP's performance to ensure the client is cared for safely in the hospital or the home. 39.1. The client's oxygen should always be placed correctly, but it is not the priority intervention for difficulty breathing. 2. Because the client has difficulty breathing while lying in bed, allowing the client to sit in a recliner will help the client, therefore, this is the priority intervention. 3. Often clients report a fan blowing on the face helps with difficulty breathing, but this is not a priority intervention. 4. Slow, deep breaths will not help the client with difficulty breathing as much as will sitting in a recliner. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, planning, client needs, physiological integrity, basic care and comfort, cognitive level, synthesis making nursing decisions, in questions that ask the test taker to identify a PRI. Already intervention. All the options are something a nurse can implement. The test taker must identify the most important intervention. 41. The body naturally begins to slow down, and clients may not wish to take in liquids or nourishment. This can produce a natural euphoria and make the dying process easier on the client. 4. Fluids would interfere with this process and would increase secretions the client cannot handle, thus making the client more uncomfortable. 2. A peg feeding tube would increase the intake of the client and would increase secretions the client cannot handle. This can require suctioning the client and further augmenting the client's discomfort. 3. Refusal to take in food and liquids produces a natural euphoria and makes the dying process easier on the client. This is an appropriate teaching statement. 4. This is a therapeutic response, but factual information is needed by the wife to accept the process. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application making nursing decisions. The NCLEX-RN registered addresses questions concerned with end-of-life care. This is included in the psychosocial integrity section of the test blueprint. 41.1. The home health nurse may be a possibility if a hospice organization is not available, but hospice is the best referral. 2. The nurse would not refer the client to his or her own pastor. The nurse could place a call to notify the pastor at the client's request, but this would not be considered a referral. 3. One of the guidelines for admission to a hospice agency is a terminal process with a life expectancy of 6 months or less. Answers 100. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. These organizations work to assist the client and family to live life to its fullest while providing for comfort measures and a peaceful, dignified death. 4. The hospital social worker is not an appropriate referral at this time. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, planning, client needs, physiological integrity, physiological adaptation, cognitive level, synthesis. Making nursing decisions, the nurse must be knowledgeable about appropriate referrals and implement the referral to the most appropriate person/agency. 42.1. This is advising and crossing professional boundaries. The nurse should not try to influence the client in these types of concerns. 2. This is advising and crossing professional boundaries. The nurse should not try to influence the client in these types of concerns. 3. This response allows the client to make his or her own decision. It validates that the nurse heard the concern but does not advise the client. 4. This is advising and crossing professional boundaries. The nurse should not try to influence the client in these types of concerns. Content: management of care, category of health alteration, respiratory, integrated processes, nursing process, implementation. Client needs, psychosocial integrity, cognitive level, application. Making nursing decisions, the nurse must always remember that nurses have positions of authority in a healthcare environment. Nurses must maintain professional boundaries at all times and refuse to cross professional boundaries. 43.1. Women tend to see the big picture and seek solutions based on what makes people feel comfortable rather than on logic. 2. Men often see the world from a logical perspective and focus on a specific intervention. 3. Men tend to ask fewer questions than women, especially if the man perceives that asking the question will make him look foolish or ignorant. 4. Men and women communicate very differently. The female manager of a male employee should recognize the difference when attempting to arrive at a common goal. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, communication, client needs, safe and effective care environment, management of care, cognitive level, application. Making nursing decisions, there will be management questions on the NCLEX-RN registered. In many instances, there is no test-taking strategy, the nurse must be knowledgeable of management issues. 44.1. The attitude of the staff member changes from one day to the next. The why is not important for the manager to know. The important thing for the manager to know is whether the staff member can control the attitude. 2. The first step is an informal meeting with the staff member to discuss the inappropriate attitude and how it affects the staff. The manager should document the conversation informally with the date and time. The staff member does not need to see this documentation, for future reference. If the situation is not resolved, a formal counseling must take place. 3. This step would follow the informal discussion if the attitude did not improve. 4. This is a step sometimes used to get the attention of the staff member when formal counseling has not been effective. This step occurs just before termination. Content: management of care, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. There will be management questions. On the NCLEX-RN registered. In many instances, there is no test-taking strategy, the nurse must be knowledgeable of management issues. 45.1. Emails should be easy to read and concise. Individuals may not take the time to read and understand poorly worded, lengthy emails. 2. Some communication is appropriate by email, but when discussing a problem with an individual, it is best to use face-to-face communication in which both parties can give and receive feedback. 3. Capital letters in emails may be interpreted as shouting or yelling at the receiver. 4. Email communication should be concise and easy to read. If the email requires a lot of information, then the writer should use bullets to separate information. Content: medical/surgical, category of health alteration, communication, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application. Chapter 4 Respiratory Management 101 Making Nursing Decisio. NS, there will be management questions on the NCLEX-RN registered. In many instances, there is no test-taking strategy, the nurse must be knowledgeable of management issues. 46.1. The problem is not a nursing problem. The HCP should be discussing the problem with an individual from the department that owns the problem. 2. This is not a nursing problem. 3. This is not a nursing problem. 4. This will only make the HCP angrier. The HCP should be directed to discuss the problem with the department that can fix the problem. Content: management of care, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. There will be management questions. On the NCLEX-RN registered. In many instances, there is no test-taking strategy, the nurse must be knowledgeable of management issues. 47. Correct answer: 1, 4, 3, 2, 5. 1. The nurse should begin the care by assessing the client. Remember the nursing process. 4. The nurse should have the client's chest and dressing exposed and should check to make sure the chest tube is securely taped at this time. 3. The nurse then follows the chest tube to the drainage system and assesses the system. 2. The last part of the chest tube drainage system to assess is the suction system. 5. The nurse should make sure that emergency supplies are at the bedside last. Content: medical/surgical, category of health alteration, respiratory integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. This is an alternate type of question included in the NCLEX-RN registered blueprint. The nurse must be able to perform skills in the correct order. Assessment should always be the first intervention if the client is not in distress. 48.1. Bronchiectasis is a condition in which the lungs' airways are abnormally stretched and widened. This is caused by mucus blockage, which allows bacteria to grow and leads to infection. Signs/symptoms include coughing, abnormal breath sounds, and clubbing. Therefore, the nurse would not assess this client first. 2. Bisonosis, brown lung disease, is a lung disease caused by exposure to dust from cotton processing, hemp, and flax. Signs/symptoms include chest tightness, cough, and wheezing. Therefore, this client would not be assessed first. 3. Cystic fibrosis, CF, is an inherited disease that causes thick, sticky mucus to form in the lungs, pancreas, and other organs. In the lungs, this mucus blocks the airways, causing lung damage and making it hard to breathe. A pulse oximeter reading of 90% equates to approximately a 60% arterial saturation. The nurse should assess this client first. 4. Pneumoconiosis, known as black lung disease, is an occupational lung disease caused by inhaling coal dust. The signs/symptoms are shortness of breath and chronic cough. Therefore, this client would not be assessed first. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions, the test taker must determine which sign/symptom is not expected for the disease process. If the sign/symptom is not expected, then the nurse should assess the client first. This type of question is determining if the nurse is knowledgeable of signs/symptoms of a variety of disease processes. 49.1. Activity intolerance is not priority over gas exchange. If gas exchange does not occur, the client will die. 2. Coping is a psychosocial problem, and physiological problems are priority. 3. Impaired gas exchange is the priority problem for this client. If the client does not have adequate gas exchange, the client will die. Remember Maslow's hierarchy of needs. 4. Self-care deficit is not priority over gas exchange. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, assessment, client needs, physiological integrity, physiological adaptation, cognitive level, analysis. Making nursing decisions, the NCLEX-RN registered integrates the nursing process through the answers 102. Prioritization, delegation, and management of care for the NCLEX-RN registered exam client needs categories and subcategories. The nursing process is a scientific, clinical reasoning approach to client care that includes assessment, analysis, planning, implementation, and evaluation. The nurse will be responsible for identifying nursing diagnosis for clients. 51. Consolidation indicates fluid or exudates in the lung pneumonia. This would not indicate the client is improving. 2. Bilateral breath sounds indicate the left lung has re-expanded and the treatment is effective. 3. Vigorous bubbling in the suction chamber indicates that there is a leak in the system, but this does not indicate the treatment is effective. 4. Crepitus, subcutaneous emphysema, indicates that oxygen is escaping into the subcutaneous layer of the skin, but this does not indicate the lung has re-expanded, which is the goal of the treatment. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, assessment, client needs, safe and effective care environment, safety and infection control, cognitive level, analysis. Making nursing decisions, the nurse should realize a normal finding indicates the medical treatment is effective. If the nurse is vacillating between two options and one option is equipment, the nurse should select the client's body as the correct answer. 51.1. Jugular vein distension would indicate the client has CHF. This is not a complication of a loop diuretic. 2. Rales and rhonchi are symptoms of pulmonary edema, not a complication of a loop diuretic. 3. Leg cramps may indicate a low serum potassium level, which can occur as a result of the administration of a diuretic. 4. This would indicate the medication is effective and is not a complication of the medication. Content: medical/surgical category of health alteration, respiratory, integrated processes, nursing process, assessment, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis. Making nursing decisions, the nurse must be aware of D. Actions of medications. The nurse must be aware of assessment data indicating the medication is effective or the medication is causing a side effect or an adverse effect. 52.1. Non-malfeasance means to do no harm. This statement is letting the client know that the concern has been heard but does not give the client bad news before surgery. The nurse is aware that someone having surgery should be of sound mind, and finding out your child is dead would be horrific. 2. This is an example of veracity. 3. This is an example of paternalism, telling the client what he or she should do. 4. This is a therapeutic response, not an example of non-malfeasance. Content: medical/surgical, category of health alteration, ethics, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application. Making nursing decisions, the NCLEX-RN registered blueprint includes nursing CR that addresses ethical principles, including autonomy, beneficence, justice, and veracity, to name a few. 53.1. The Joint Commission is an organization that monitors healthcare facilities for compliance with standards of care. Accreditation is voluntary, but most third-party payers will not reimburse a facility that is not accredited by some outside organization. 2. Accreditation does not guarantee reimbursement, although most third-party payers require some accreditation by an outside organization. 3. Accreditation does not reduce the hospital's liability. 4. Medicare/Medicaid will not review a facility routinely if the Joint Commission has accredited the facility, but a representative will review the facility in cases of reported problems. Content: management of care, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application. Making nursing decisions, the NCLEX-RN registered blueprint includes nursing care that is ruled by legal requirements as well as Joint Commission, Medicare and Medicaid services, Centers for Disease Control and Prevention, and Occupational Safety and Health Administration rules and regulations. The nurse must be knowledgeable of these standards. 54.1. The nurse should offer self to the significant other. Ignoring the needs of the significant other at this time makes the significant other feel that the nurse does not care, and if the nurse does not care. Chapter 4 Respiratory Management 103 For me, then did the nurse provide adequate care to my loved one? This action is very important to assist in the grieving process. 2. The UAP can gather the deceased client's belongings. 3. The UAP can perform post-mortem care. 4. The representative of the organ donation team will make this request. Organ banks think it is best for specially trained individuals to discuss organ donation with the significant others. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application. Making nursing decisions, the NCLEX-RN registered addresses questions concerned with end-of-life care. This is included in the psychosocial integrity section of the test blueprint. If unsure of the correct option, selecting an option addressing an individual is a better choice. 55.1. Coumadin is an oral, not intravenous, medication. 2. The therapeutic PTT results should be 1.5 to 2 times the control, or 51 to 68 seconds. The client's value of 53 is within the therapeutic range. The nurse should continue the heparin drip as is. 3. The INR is not up to therapeutic range yet, so warfarin, Coumadin, should be administered. 4. These lab values do not provide any information about aspirin administration, but the nurse should ask the HCP whether aspirin, an antiplatelet, should be discontinued because the client is receiving 2 anticoagulants heparin and warfarin. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application making nursing decisions. This is an alternate type of question included in the NCLEX-RN registered blueprint. The test taker must be able to read a chart, must be knowledgeable of laboratory data, and must be able to make appropriate decisions as to the nurse's most appropriate action. 56.1. A rapid response team, RRT, is called when the nurse assesses a client whose condition is deteriorating. The purpose of an RRT is to intervene to prevent a code. In the scenario described, the situation has not progressed to an arrest. The nurse should call an RRT, but administering oxygen is the first intervention. 2. The first action is to increase the client's oxygen to 100%. 3. The nurse could check the ABG results, but the client is in distress and the nurse should implement an intervention to relieve the distress. 4. A fast-acting inhaler should be used, but not until after the oxygen has been increased and an RRT called. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis making nursing decisions. The nurse should remember, if a client is in distress and the nurse can do something to relieve the distress, that should be done first, before assessment. The test taker should select an option that directly helps the client's condition. 57.1. The client may eventually need to be transferred to a facility that accepts long-term ventilator-dependent clients, but the nurse would not anticipate this at this time. 2. The client on a ventilator will have blood gases ordered more often than daily. 3. The stem does not indicate that the client is ready to be removed from the ventilator. 4. A client who has been intubated for 10 to 14 days and still requires mechanical ventilation should have a surgically placed tracheostomy to prevent permanent vocal cord damage. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, analysis, client needs, physiological integrity, reduction of risk potential, cognitive level, knowledge making nursing decisions. The nurse must be knowledgeable of expected medical treatment for the client. This is a knowledge-based question. 58.1. The child's skin will normally taste salty, but this is not the priority intervention to teach. 2. The parents should be asked about the client's stools during an assessment because the effectiveness of the pancreatic enzymes is evaluated by the consistency of the stool. This is not the priority intervention because the child must take the enzymes before monitoring the consistency of the stool. 3. Cystic fibrosis is a genetic condition that results in blockage of the pancreatic ducts. The child needs pancreatic answers 104 prioritization, delegation, and management of care for the NCLEX-RN registered exam enzymes to be administered with every meal and snack so the enzymes will be available when the food gets to the small intestine. 4. Cystic fibrosis is one of the few diseases that requires salt replacement, but salt replacement is not more important than taking the pancreatic enzymes. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, physiological integrity, physiological adaptation, cognitive level, knowledge making nursing decisions. The nurse must be knowledgeable of expected medical treatment for the client. This is a knowledge-based question. 59.1. The UAP should be sensitive to the client's preferences and not insist that the client miss the program. 2. The UAP should arrange an acceptable time for the client, and the UAP can return to complete the task at the agreed on time. 3. This is the best instruction for the nurse to give to the UAP. 4. The bath has not been refused. The client does not want the program interrupted. Content, management of care, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, physiological integrity, basic care and comfort, cognitive level, synthesis making nursing decisions, delegation means the nurse is responsible for the UAP's actions and performance. The nurse must provide guidance to the UAP. 61. Effective group process involves all members of the group. 2. Unanimous decisions may indicate groupthink, which can be a problem in a group process. 3. Effective group process involves all members of the group, not just 2. 4. Not allowing deviation from the agenda is an autocratic style and limits the creativity and involvement of the group. Content, management of care, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application making nursing decisions. There will be management questions on the NCLEX-RN registered. In many instances, there is no test-taking strategy, the nurse must be knowledgeable of management issues. 61.1. The ventilator should be checked to determine which alarm is sounding. This is the first step in assessing the client's problem. 2. The nurse should assess the ventilator and the client and then notify the respiratory therapist, if needed. 3. The client should be assessed, but the ventilator may require only a simple adjustment to fix the problem and turn off the alarm. This is one instance in which the nurse should assess the machine prior to assessing the client because the machine is breathing for the client. 4. The client should be manually ventilated if the nurse cannot determine the cause of the ventilator alarm. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application making nursing decisions. The nurse must determine if the client is in distress. Remember, if in distress, do not assess. The nurse must intervene to help the client. In most situations, the nurse should not select equipment over the client's body. However, when the equipment is breathing for the client, the equipment should be assessed first. 62.1. Acute respiratory distress syndrome is diagnosed when the client has an arterial blood gas of less than 50% while receiving oxygen at 10 lpm. The nurse should prepare for the client to be intubated. 2. The nurse should intervene while the client is breathing by calling the HCP and assisting in the intubation and setup of the mechanical ventilator. If the client has an arrest before this can be arranged, the client would be ventilated with a bag/mask device. 3. If the nurse does not intervene immediately, an arrest situation will occur, at which time a code blue would be called and CPR started. 4. If the client does not have a patent for, the nurse should start one, but not before preparing for intubation. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, knowledge making nursing decisions. The nurse must be knowledgeable of D medical treatment for the client. This is a knowledge-based question. Chapter 4 Respiratory Management 105-63. 1. These blood gases indicate respiratory acidosis that could be caused by ineffective cough, with resulting air trapping. The nurse should encourage the client to turn, cough, and deep breathe. 2. The PaO2 level is within normal limits, 80 to 100. Administering oxygen is not the first intervention. 3. The nurse knows the arterial blood gas oxygen level, which is an accurate test. The pulse oximeter only provides an approximate level. 4. This is not the first intervention. The nurse can intervene to treat the client before notifying the HCP. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, knowledge making nursing decisions. The nurse must be knowledgeable of D. Medical treatment for the client. This is a knowledge-based question. 64.1. The nurse should first prevent circulatory collapse by starting 2 IVs and initiating normal saline or Ringer's lactate. The cross-match may be needed if the shock condition is caused by hemorrhage. 2. The client is exhibiting symptoms of shock. The nurse should start 4 lines to prevent the client from progressing to circulatory collapse. 3. All clients have a history taken and physical examination performed as part of the admission process to the emergency department, but this is not the first intervention. 4. Checking the client's allergies to medications is important, but it is not the first intervention in a client exhibiting signs of shock. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis making nursing decisions. The nurse should remember if a client is in distress and the nurse can do something to relieve the distress, that should be done first, before assessment. The test taker should select an option that directly helps the client's condition. 65.1. This client is nearing discharge status. Postoperative clients are progressed rapidly. A medical surgical nurse could take care of this client. 2 chest tubes are frequently cared for on a medical surgical unit. The medical surgical nurse can care for this client. 3. This client's status is uncertain. The ICU nurse would be an appropriate assignment for this client since the patient will be moved to ICU soon. 4. A medical surgical nurse can care for this client. 5. The intensive care nurse should care for this client requiring titration of multiple medications simultaneously. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, planning client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The charge nurse must decide which clients need at a higher level of expertise to make this decision. Those clients requiring a higher level of expertise should be assigned to the nurse with the greatest knowledge in certain areas. 66.1. This position allows for access to the client's back area. The chest tube for a hemothorax is positioned low and posterior to allow for gravity to assist in the removal of fluid from the thoracic area. 2. This is the position for giving an enema. 3. This is the position used to assist with a lumbar puncture. 4. This is a resting position. It is not preparing for a chest tube placement. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, physiological integrity, physiological adaptation, cognitive level, analysis making nursing decisions. The nurse must have knowledge of basic anatomy and physiology to answer this question. Hema means blood and thorax refers to the thoracic cavity. Blood is in the area where the lung needs to expand. Blood is heavier than air, so the client should be positioned to access the area where dependent drainage will occur. 67.1. Starting an intravenous line must be done prior to being able to initiate a piggyback medication. 2. In order to treat the client with the most effective medication and not skew the results of a sputum culture, the specimen must be obtained prior to initiating antibiotics. 3. New orders for intravenous antibiotics must be considered a priority to prevent the client answers 106 prioritization, delegation, and management of care for the NCLEX-RN registered exam from going into gram-negative sepsis, a potentially lethal situation. However, in order to initiate the antibiotic, the nurse must make sure a correct diagnosis is able to be made. 4 respiratory treatments are important, but not before starting the antibiotics. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application making nursing decisions, to arrive at the correct priority intervention. The test taker must decide if one option must be accomplished prior to initiating other options. 68.1. Shortness of breath after ambulating is expected for a patient diagnosed with COPD. 2 patients diagnosed with deep vein thrombosis are at risk for pulmonary embolism, PE. Anxiety is a symptom of PE. The nurse must determine if interventions are needed for PE, a life-threatening emergency. 3. Anyone can take a specimen to the laboratory. 4. An empyema is an abscess in the thoracic cavity. These vital signs would be expected for this patient. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions, when deciding which patient to assess first, th. Here are rules. 1 is the situation life-threatening or life-altering. 2 is the information/data presented abnormal or unexpected. 3 is the information expected for the disease process. Or is the problem a psychosocial one? 4 are the data within normal limits? The test taker should choose the correct answer based on 1 first, 2 next, 3 next, and 4 last. 69 Answer, 2160 ml intake and 925 ml output. The urinary output is not used in this calculation. The nurse must add up both intravenous fluids and oral fluids to obtain the total intake for this client. 1500 plus 100 equals 1500 for fluids, 1 ounce equals 30 ml, 12 ounces 30 yen ml equals 360 ml, 6 ounces yen 30 ml equals 180 ml, 4 ounces 30 yen ml equals 120 ml, 360 plus 180 plus 120 equals 660 oral fluids. Total intake is 1500 plus 660 equals 2160. The urinary output 800 ml plus chest drainage 125 ml equals 925 ml for shift output. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, application making nursing decisions, the NCLEX-RN registered blueprint Inc. Ludes dosage calculations under pharmacological and parenteral therapies. This category is included under physiological integrity, which promotes physical health and wellness by providing care and comfort, reducing client risk potential, and managing health alterations. 71. Bronchiolitis is an inflammation of the bronchioles, which are the small airways in the lungs. Signs/symptoms include wheezy cough, rapid breathing, cyanosis, nasal flaring, muscle retractions, and fever. Because the client is exhibiting expected signs/symptoms, this client should be assigned to the graduate nurse. 2. Dull percussion and vocal fremitus indicate consolidation. Consolidation is fluid instead of air in the alveolar space. This is a potentially life-threatening situation and should not be assigned to a new graduate. 3. Flail chest describes a situation in which a portion of the rib cage is separated from the rest of the chest wall, usually due to a severe blunt trauma, such as a serious fall or a car accident. This affected portion is unable to contribute to expansion of the lungs. Flail chest is a serious condition that can lead to long-term disability and even death. The charge nurse should assign this client to a more experienced nurse. 4. The client with reactive airway disease, asthma, should be asymptomatic, therefore, When the client is wheezing, the client is having an acute exacerbation and should be assigned to a more experienced nurse. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis, making nursing decisions. When the test taker is deciding which client should be assigned to a new graduate, the most stable client should be assigned to the least experienced nurse. Chapter 4: Respiratory Management. 107 Clinical Scenario Answers and Rationales. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. The client with pneumonia is expected to have bilateral crackles, and an SAO2 of 96% is stable. Therefore, this client would not be assigned to the most experienced nursing. 2. This client is exhibiting typical signs of adult respiratory distress syndrome, ARDS, therefore, Ms. Gale should assign the most experienced nurse to this client. 3. The postoperative client with purulent drainage could be developing an infection and should be assessed but is not priority over a client who is experiencing respiratory distress. 4. The client with a tonsillectomy is expected to have pain on the same day of surgery. Any nurse should be able to care for this client. 2.1. The nurse should administer the prescribed antibiotic as soon as possible but not prior to obtaining sputum culture. 2. The client with pneumonia needs more than 2 L oxygen via nasal cannula, which would be appropriate for a client diagnosed with chronic obstructive pulmonary disease. 3. The nurse needs to obtain a sputum culture prior to administering antibiotic because the culture and sensitivity will be skewed if the client receives antibiotics. This should be the first HCP implemented. 4. The client with pneumonia is not placed in respiratory isolation. This HCP order should be questioned. 3.1. Placing the client in the orthopnic position will help the client breathe easier. The position assumed by clients with orthopnea is one in which they are sitting propped up in bed by several pillows. 2. The client with COPD must have low oxygen levels less than 3 L/min. COPD clients breathe because of oxygen hunger, and high levels of O2 provide so much oxygen that the client loses the stimulus to breathe. 3. The client is in distress. Therefore, the nurse should not assess but instead do something to help the client. The nurse should not treat a machine. 4. The nurse should implement an intervention first since the client is in distress, then notify the respiratory therapist. 4.1. The LPN would be able to care for a client 2 days postoperative. Crepitus is air in the subcutaneous tissue but is not life-threatening. 2. The client who is confused is not stable, therefore, the nurse cannot assign this client to the LPN. The nurse cannot assign assessment, teaching, evaluation, or an unstable client to the LPN. 3. The nurse cannot assign teaching, therefore, this client cannot be assigned to an LPN. 4. The client's pulse oximetry is less than 93%. Therefore, this client is unstable and cannot be assigned to an LPN. 5.1. The client with active tuberculosis is usually administered rifampin, which causes urine and bodily fluids to turn orange. 2. The client who is post-op would be expected to have pain, so this client would not need immediate intervention. The client who has signs/symptoms not expected for the disease process/condition would require immediate intervention. 3. The client with a pneumothorax should not have blood in the collection chamber. The client with a hemothorax would be expected to have bloody drainage. This client requires immediate intervention by Ms. Gale. 4. A client with bacterial pneumonia would be expected to have elevated temperature and chills, therefore, this client does not require immediate intervention. 6.1. Carafate coats the stomach and must be administered on an empty stomach. Therefore, the nurse would not question administering this medication. 2. The therapeutic digoxin level is 0.8 to 2.0 mg/dl, therefore, the nurse would not question administering this medication. 3. The therapeutic PTT for the client receiving heparin is 58 to 78. Therefore, the nurse would not question administering this medication. 4. The client on an aminoglycoside antibiotic with an elevated trough level should not receive the medication. The elevation could lead to ototoxicity or nephrotoxicity. Therefore, the nurse should question administering this medication. 7.1. The client needs oxygen to help perfuse the lungs, heart, and body, therefore, this is the first intervention Ms. Gale should tell the nurse to implement. Scenario answers 108. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 2. The client will need a ventilation/perfusion scan to confirm the diagnosis of pulmonary embolus, but it is not the nurse's first intervention. 3. The nurse will need to notify the client's healthcare provider but not prior to taking care of the client's body. 4. Assessing the client is indicated, but it is not the first intervention in this situation. Remember, if the client is in distress, do not assess. Take an action to help the client. 8.1. The nurse should document the client's complaints in the nurse's notes, but it is not the first intervention. The nurse should first assess the client. 2. Taking slow deep breaths will not address the client's pain of 6 on the pain scale. 3. The nurse must first determine whether the pain is expected for the client's condition or whether the client is experiencing a complication requiring nursing or medical intervention. This is the nurse's first intervention. 4. The nurse must check the MAR when it is determined the pain is expected and requires pain medication, but it is not the first intervention. 9.1, 4, and 5 are correct. 1. The client should be in a high Fowler's position to facilitate lung expansion. 2. The system must be patent and intact to function properly, but it should be assessed more often than every shift. It should be assessed every 2 to 4 hours. 3. The client can have bathroom privileges, and ambulation facilitates lung ventilation and expansion. 4. The tubing should not have any dent loops. Looping the tubing prevents direct pressure on the chest tube itself and keeps tubing off the floor, addressing both a safety and an infection control issue. 5. The collection chamber of the Pleurovac should be marked at the end of every shift and is part of the total output for the client. 10.1. The client suspected of having ARDS is not stable and should not be assigned to an LPN. A more experienced nurse should be assigned this client. 2. The LPN cannot administer blood, therefore, this client should not be assigned to the LPN. 3. Jugular vein distension and hypotension are signs of attention pneumothorax, which is a medical emergency, and the client should be assigned to an RN. 4. A client scheduled for a bronchoscopy is stable and should be assigned to the LPN. This client is the most stable and least critical. 109. Gastrointestinal management. 5. Let whoever is in charge keep this simple question in her head: not how can I always do the right thing myself, but how can I provide for this right thing always to be done. Florence Nightingale. 1. The nurse is caring for clients on a medical unit. Which task should the nurse implement first? 1. Change the abdominal surgical dressing for a client who has ambulated in the hall. 2. Discuss the correct method of placing Montgomery straps on the client with the UAP. 3. Assess the male client who called the desk to say he is nauseated and just vomited. 4. Place a call to the extended care facility to give the report on a discharged client. 2. The nurse is preparing a client diagnosed with peptic ulcer disease for a barium study of the stomach and esophagus. Which nursing intervention is the priority for this client? 1. Obtain informed consent from the client for the diagnostic procedure. 2. Discuss the need to increase oral fluid intake after the procedure. 3. Explain to the client that he or she will have to drink a white, chalky substance. 4. Tell the client not to eat or drink anything prior to the procedure. 3. Which client warrants immediate intervention from the nurse on the medical unit? 1. The client diagnosed with dyspepsia who has eructation and bloating. 2. The client diagnosed with pancreatitis who has steatorrhea and pyrexia. 3. The client with diverticulitis who has left lower quadrant pain and fever. 4. The client with Crohn's disease who has right lower abdominal pain and diarrhea. 4. The nurse and the unlicensed assistive personnel, UAP, are caring for clients on a medical surgical unit. Which task should not be assigned to the UAP? 1. Instruct the UAP to feed the 69-year-old client who is experiencing dysphagia. 2. Request the UAP change the linens for the 89-year-old client with fecal incontinence. 3. Tell the UAP to assist the 54-year-old client with a bowel management program. 4. Ask the UAP to obtain vital signs on the 72-year-old client diagnosed with cirrhosis. 5. Which behavior by the unlicensed assistive personnel, UAP, requires immediate intervention by the nurse? 1. The UAP is refusing to feed the client diagnosed with acute diverticulitis. 2. The UAP would not place the client on the bedside commode who was on bed rest. 3. The UAP placed the client with a continuous feeding tube in the supine position. 4. The UAP placed sequential compression devices on the client who is on strict bed rest. Question 6. The nurse is concerned about the documentation form for blood administration, and other staff members agree the documentation is cumbersome and needs to be revised. Which action is most appropriate for the nurse to implement first? 1. Discuss the blood administration flow sheet with the chief nursing officer. 2. Contact an individual to help design a new blood transfusion flow sheet. 3. Learn to adapt to the present form and do not take any further action. 4. Volunteer to be on an ad hoc committee to research alternate flow sheets. 7. The charge nurse is transcribing HCP orders for a client scheduled for a barium enema. In addition to the radiology department, which department of the hospital should be notified of the procedure? 1. The cardiac catheterization department. 2. The dietary department. 3. The nuclear medicine department. 4. The hospital laboratory department. 8. The charge nurse is making assignments on a medical unit. Which client should the nurse assign to the graduate nurse? 1. The client who has received 3 units of packed red blood cells, RBCs. 2. The client scheduled for an esophagogastroduodenoscopy in the morning. 3. The client with short bowel syndrome who has diarrhea and a K+ level of 3.3 milliequivalent/L. 4. The client who has just returned from surgery for a sigmoid colostomy. 9. At 0830, the day shift nurse is preparing to administer medications to the client NPO for an endoscopy. Which medication should the nurse question administering? Select all that apply. 110. Prioritization, delegation, and management of care for the NCLEX-RN registered exam client's name, account number, 123,456 allergies, penicillin date, signature/initials medication Lanoxin, digoxin, 0.1. 25 mg po everyday Lasix, furosemide, 40 mg po Bidzantac, ranitidine, 150 mg in 250 ml NS4 continuous infusion every 24 hours vancomycin 850 mg IV PB every 24 hours Mylanta 30 ml po PRN heartburn. 0701 to 1500 090009000900 Night Nurse RNNN 2301 to 07000300NN at 11 ml/HR Day Nurse RNDN 1501 to 2300 1600 2101 Lanoxin, digoxin, 0.125 mg po every day. 2 Lasix, furosemide, 40 mg po bid. 3 Zantac, ranitidine, 150 mg in 250 ml NS4 continuous infusion every 24 hours. 4. Vancomycin 850 mg IV PB every 24 hours. 5. Mylanta 30 ml po PRN heartburn. 10. Which client should the nurse assess first after receiving the PM shift assessment? 1. The client with Barrett's esophagus who has dysphagia and pyrosis. 2. The client with proctitis who has tenesmus and passage of mucus through the rectum. 3. The client with liver failure who is jaundiced and has ascites. 4. The client with abdominal pain who has an 8-hour urinary output of 150 ml/hr. 11. The nurse is planning the care of a client diagnosed with acute gastroenteritis. Which nursing problem is priority? 1. Altered nutrition. 2. Self-care deficit. 3. Impaired body image. 4. Fluid and electrolyte imbalance. 12. The nurse is preparing to administer morning medications to clients on a medical unit. Which medication should the nurse administer first? 1. Methylprednisolone, solumedrol, a steroid, to a client diagnosed with Crohn's disease. 2. Donepezil, Aricept, an acetylcholinesterase inhibitor, to a client with dementia. 3. Sucralfate, Carafate, a mucosal barrier agent, to a client diagnosed with ulcer disease. 4. Enoxaparin, Lovenox, an anticoagulant, to a client on bed rest after abdominal surgery. 13. The nurse has received the morning shift report on a surgical unit in a community hospital. Which client should the nurse assess first? 1. The client who is 6 hours postoperative small bowel resection who has hypoactive bowel sounds in all 4 quadrants. 2. The client who is scheduled for an abdominal peritoneal resection this morning and is crying and upset. 3. The client who is 1 day postoperative for abdominal surgery and has a rigid, hard abdomen. 4. The client who is 2 days postoperative for an emergency appendectomy and is complaining of abdominal pain, rating it as an 8 on a pain scale of 1 to 10. 14. The charge nurse is reviewing the morning laboratory results. Which data should the charge nurse report to the HCP via telephone? 1. The client who is 4 hours postoperative for gastric lap banding with a white blood cell, WBC, count of 15,000 mm. 2. The client who is 1 day postoperative total colectomy with creation of an ileal conduit who has a hemoglobin and hematocrit level of 12/36. 3. The client who is 4 days postoperative for gastric bypass surgery whose fasting blood glucose level is 180 mg/dl. 4. The client who is 8 hours postoperative for exploratory laparotomy who has a serum potassium level of 4.5 milliequivalent/L. 15. The nurse is preparing clients for surgery. Which client has the greatest potential for experiencing complications? 1. The client scheduled for removal of an abdominal mass who is overweight. 2. The client scheduled for a gastrectomy who has arterial hypertension. 3. The client scheduled for an open cholecystectomy who smokes 2 packs of cigarettes per day. 4. The client scheduled for an emergency appendectomy who smokes marijuana on a daily basis. Questions Chapter 5 Gastrointestinal Management 111-16. The nurse is performing ostomy care for a client who had an abdominal peritoneal resection with a permanent sigmoid colostomy. Rank the following interventions in order of priority. 1. Cleanse the stomal site with mild soap and water. 2. Assess the stoma for a pink, moist appearance. 3. Monitor the drainage in the ostomy drainage bag. 4. Apply stoma adhesive paste to the skin around the stoma. 5. Attach the ostomy drainage bag to the abdomen. 17. The nurse is transcribing the HCP's orders for a client who is scheduled for an emergency appendectomy and is being transferred from the emergency department, ED, to the surgical unit. Which order should the nurse implement first? 1. Obtain the client's informed consent. 2. Administer 2 mg of 4-morphine, every 4 hours, PRN. 3. Shave the lower right abdominal quadrant. 4. Administer the on-call IVPB antibiotic. 18. The client 1 day postoperative abdominal surgery has an evisceration of the wound. Which intervention should the nurse implement first? 1. Place sterile normal saline gauze on the eviscerated area. 2. Reinforce the abdominal dressing with an ABD pad. 3. Assess the client's abdominal bowel sounds. 4. Place the client in the left lateral position. 19. The medical surgical nurse has just received the AM shift report. Which client should the nurse assess first? 1. The client who has a paralytic ileus and has absent bowel sounds. 2. The client who is 2 days post-op abdominal surgery and has a soft, tender abdomen. 3. The client who is 6 hours postoperative and has an abdominal wound dehiscence. 4. The client who had a liver transplant and is being transferred to the rehabilitation unit. 20. The client is being prepared for a colonoscopy in the day surgery center. The charge nurse observes the primary nurse instructing the unlicensed assistive personnel, UAP, to assist the client to the bathroom. Which action should the charge nurse implement? 1. Take no action because this is appropriate delegation. 2. Tell the UAP to obtain a bedside commode for the client. 3. Discuss the inappropriate delegation of the nursing task. 4. Document the situation in an adverse occurrence report. 21. The nurse is caring for clients on a surgical unit. Which client should the nurse assess first? 1. The client who has been vomiting for 2 days and has an ABG of pH 7.47, PAO 295, PACO 244, HCO 330. 2. The client who is 8 hours postoperative for splenectomy and who is complaining of abdominal pain, rating it as a 9 on a pain scale of 1 to 10. 3. The client who is 12 hours postoperative abdominal surgery and has dark green bile draining in the nasogastric tube. 4. The client who is 2 days postoperative for hiatal hernia repair and is complaining of feeling constipated. 22. The unlicensed assistive personnel, UAP, tells the nurse angrily, "You are the worst nurse I have ever worked with and I really hate working with you." Which action should the nurse implement first? 1. Don't respond to the comment and appraise the situation. 2. Tell the UAP to leave the unit immediately. 3. Report this comment and behavior to the charge nurse. 4. Explain to the UAP that he or she cannot talk to the primary nurse like this. 112. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 23. The client is admitted to the critical care unit after a motor vehicle accident. The client asks the nurse, "Do you know if the person in the other car is all right?" The nurse knows the person died. Which statement supports the ethical principle of veracity? 1. I am not sure how the other person is doing. 2. I will try to find out how the other person is doing. 3. You should rest now and try not worry about it. 4. I am sorry to have to tell you, but the person died. 24. The client admitted to the critical care unit tells the nurse, "I have an advance directive, AD, and I do not want to have cardiopulmonary resuscitation, CPR, Which intervention should the nurse implement first? 1. Ask the client for a copy of the AD so that it can be placed in the chart. 2. Inform the healthcare provider of the client's request as soon as possible. 3. Determine whether the client has a durable power of attorney for healthcare. 4. Request the hospital chaplain to come and talk to the client about this request. 25. The client is diagnosed with esophageal bleeding. Which of the following assessment data warrants immediate intervention by the nurse? 1. The client's hemoglobin/hematocrit is 11.4/32. 2. The client's abdomen is soft to touch and non-tender. 3. The client's vital signs are T99, AP100, and 14, RR18, B/P88/60. 4. The client's nasogastric tube has coffee ground drainage. 26. Which task should the nurse in the long-term care facility delegate to the unlicensed assistive personnel, UAP? 1. Assist the resident up in a wheelchair for meals. 2. Assess the incontinent client's perianal area. 3. Discuss requirements with the client for going out on a pass. 4. Explain how to care for the client's colostomy to the family. 27. The nurse and the unlicensed assistive personnel, UAP, are caring for a client on a medical unit who has difficulty swallowing and is incontinent of urine and feces. Which task should the nurse delegate to the unlicensed assistive personnel, UAP? 1. Check the client's peg feeding tube for patency. 2. Place duoderm wound care patches on the client's coccyx. 3. Apply non-medicated ointment to the client's perineum. 4. Suction the client during feeding to prevent aspiration. 28. Which behavior by the unlicensed assistive personnel, UAP, warrants intervention by the long-term care nurse? 1. The UAP is giving the client with a gastrostomy tube a glass of water. 2. The UAP is ambulating the client outside using a safety belt. 3. The UAP is assisting the client with putting a jigsaw puzzle together. 4. The UAP is giving a back rub to the client who is on bed rest. 29. The nurse is preparing to teach the male client how to irrigate his sigmoid colostomy. Which intervention should the nurse implement first? 1. Demonstrate the procedure on a model. 2. Provide the client with written instructions. 3. Ask the client whether he has any questions. 4. Show the client all of the equipment needed. 30. The LPN tells the nurse the client diagnosed with liver failure is getting more confused. Which intervention should the nurse implement first? 1. Assess the client's neurological status. 2. Notify the client's healthcare provider. 3. Request a stat ammonia serum level. 4. Tell the LPN to obtain the client's vital signs. Questions Chapter 5 Gastrointestinal Management 113-31. The nurse is changing the client's colostomy bag. Which interventions should the nurse implement? Rank in the order of priority. 1. Remove the client's colostomy bag. 2. Apply the client's new colostomy bag. 3. Don non-sterile gloves. 4. Assess the client's stoma site. 5. Cleanse the area around the client's stoma. 32. Which task is most appropriate for the home healthcare nurse to delegate to the unlicensed assistive personnel, UAP? 1. Instruct the UAP to give the herb ginkgo biloba to the client with Alzheimer's. 2. Ask the UAP to perform the tube feedings for a client with a gastrostomy tube. 3. Request the UAP to perform the daily colostomy irrigation for the client. 4. Tell the UAP to wash and dry the client's hair. 33. Which behavior by the UAP warrants intervention by the home health, HH, nurse? The client tells the HH nurse the UAP, 1. Would not accept a birthday gift from the client. 2. Gave the client a vase of flowers from the UAP's garden. 3. Picked up the client's prescriptions from the pharmacy. 4. Cleaned the client's bathroom, including scrubbing the commode. 34. The female client, diagnosed with diverticulosis, called the home healthcare agency and told the nurse, I am having really bad pain in my left lower stomach and I think I have a fever. Which action should the nurse take? 1. Recommend the client take an antacid and lie flat in the bed. 2. Instruct one of the nurses to visit the client immediately. 3. Tell the client to have someone drive them to the emergency room. 4. Ask the client what she has had to eat in the last 8 hours. 35. The client with a sigmoid colostomy has an excoriated area around the stoma that has not improved for more than 2 weeks. Which intervention is most appropriate for the home health nurse, HH, to implement? 1. Refer the client to the wound care nurse. 2. Notify the client's healthcare provider. 3. Continue to monitor the stoma site. 4. Place carré paste over the excoriated area. 36. The client, who is terminally ill, tells the nurse, I just want to live to see my grandson graduate in 2 months. Which stage of grief is the client experiencing? 1. Anger. 2. Bargaining. 3. Depression. 4. Acceptance. 37. The nurse is discussing end-of-life care, EOL, with the client diagnosed with pancreatic cancer. Which statements are the goals for end-of-life care? Select all that apply. 1. To provide comfort and supportive care during the dying process. 2. To plan and arrange the funeral for the client. 3. To improve the client's quality of life for the remaining time. 4. To help ensure a dignified death for the client and family. 5. To assist with the financial cost of the dying process. 38. The male Mexican-American client, who is terminally ill, refuses hospice services because he says it is giving up and he is not going to die. Which is the most appropriate action by the nurse? 1. Discuss the philosophy and services of palliative care with the client. 2. Take no other action and support the client's decision. 3. Contact the client's healthcare provider to discuss the prognosis. 4. Talk to the client's family members about his choice to refuse hospice. 114. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. 39. The nurse is discussing end-of-life issues with the client. The nurse is explaining about a document used for listing the person the client will allow to make healthcare decisions should he or she become unable to make informed decisions for him or herself. Which document is the nurse discussing with the client? 1. Advance directive. 2. Directive to physicians. 3. Living will. 4. Durable power of attorney for healthcare. 40. The significant other of a client diagnosed with liver cancer and who is dying asks the nurse, "What is bereavement counseling?" Which statement is the nurse's best response? 1. Bereavement counseling helps the client accept the terminal illness. 2. It provides support to you and your family in the transition to a life without your loved one. 3. We provide counseling to you and your loved one during the dying process. 4. It is group counseling for family members whose loved ones have died. 41. The nurse is working in a digestive disease disorder clinic. Which nursing action is an example of evidence-based practice, EBP? 1. Turn on the tap water to help a client urinate. 2. Use 2 identifiers to identify a client before a procedure. 3. Educate a client based on current published information. 4. Read nursing journals about the latest procedures. 42. The charge nurse notices a nurse recapping a needle in a client's room. Which action should the charge nurse take first? 1. Tell the nurse not to recap the needle. 2. Quietly ask the nurse to step into the hall. 3. Reprimand the nurse for not following procedure. 4. Notify the house supervisor of the nurse's behavior. 43. The administrative supervisor is staffing the hospital's medical surgical units during an ice storm and has received many calls from staff members who are unable to get to the hospital. Which action should the supervisor implement first? 1. Inform the chief nursing officer. 2. Notify the on-duty staff to stay. 3. Call staff members who live close to the facility. 4. Implement the emergency disaster protocol. 44. The nurse is working in a community health clinic. Which nursing task should the nurse delegate to the unlicensed assistive personnel, UAP? 1. Instruct the UAP to take the client's history. 2. Request the UAP to document the client's complaints. 3. Ask the UAP to obtain the client's weight and height. 4. Tell the UAP to complete the client's follow-up care. 45. The staff nurse is working with a colleague who begins to act erratically and is loud and argumentative. Which action should be taken by the nurse? 1. Ask the supervisor to come to the unit. 2. Determine what is bothering the nurse. 3. Suggest the nurse go home. 4. Smell the nurse's breath for alcohol. Questions Chapter 5 Gastrointestinal Management 115-46. The charge nurse is making assignments on a medical surgical unit. Which client should be assigned to the most experienced nurse? 1. The client diagnosed with lower esophageal dysfunction who is experiencing regurgitation. 2. The client diagnosed with Barrett's esophagitis who is scheduled for an endoscopy. 3. The client diagnosed with gastroesophageal reflux disease who has bilateral wheezes. 4. The client diagnosed with 1-day post-op hiatal hernia who has pain rated a 4 on a pain scale of 1 to 10. 47. The client is experiencing severe diarrhea and a serum potassium level of 3.3 milliequivalent/L. Which intervention should the nurse implement first? 1. Notify the client's healthcare provider. 2. Assess the client for leg cramps. 3. Place the client on cardiac telemetry. 4. Prepare to administer intravenous potassium. 48. The unlicensed assistive personnel, UAP, notifies the charge nurse that the male client is angry with the care he is receiving and is packing to leave the hospital. Which intervention should the charge nurse implement first? 1. Ask the client's nurse why the client is upset. 2. Discuss the problem with the client. 3. Notify the healthcare provider, HCP. 4. Have the client sign the Against Medical Advice, AMA, form. 49. The nurse is caring for a 14-year-old female client diagnosed with bulimia. Which intervention should the nurse delegate to the unlicensed assistive personnel, UAP? 1. Talk with the parents about setting goals for the client. 2. Stay with the client for 15 to 20 minutes after each meal. 3. Encourage the client to verbalize low self-esteem. 4. List for the dietitian the amount of food the client consumed. 50. The client tells the nurse in the bariatric clinic, I have tried to lose weight on just about every diet out there but nothing works. Which statement is the nurse's best response? 1. Which diets and modifications have you tried? 2. How much weight are you trying to lose? 3. This must be difficult. Would you like to talk? 4. You may need to get used to being overweight. 51. The client 2 days postoperative from a laparoscopic cholecystectomy tells the office nurse, my right shoulder hurts so bad I can't stand it. Which statement is the nurse's best response? 1. This is a result of the carbon dioxide gas used in surgery. 2. Call 911 and go to the emergency department immediately. 3. Increase the pain medication the surgeon ordered. 4. You need to ambulate in the hall to walk off the gas pains. 116. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 52. The nurse is administering medications. At 1400, the client diagnosed with gastroenteritis is complaining of being nauseated and has had a formed brown stool. Which intervention should the nurse implement? Questions Chapter 5 Gastrointestinal Management 117 1. Administer ondansetron 4 mg IVP. 2. Administer Lamitil 2 tabs PO. 3. Notify the client's healthcare provider. 4. Tell the client nothing can be administered for the nausea. 53. The nurse is caring for a client who is hemorrhaging from a duodenal ulcer. Which collaborative interventions should the nurse implement? Select all that apply. 1. Prepare to administer a Sengstaken Blakemore tube. 2. Assess the client's vital signs. 3. Administer a proton pump intravenously. 4. Obtain a type and cross match for 4 units of blood. 5. Monitor the client's intake and output. 54. The nurse is caring for a client diagnosed with peptic ulcer disease. Which assessment data would cause the client to require an immediate intervention by the nurse? 1. The client has hypoactive bowel sounds. 2. The client's output is 480 ml for 12-hour shift. 3. The client has T98.6. AP98, RR22, B/P102/78. 4. The client has coffee ground emesis. 55. The nurse is caring for a client 1 day postoperative sigmoid resection. There is a large amount of bright red blood on the dressing. Which intervention should the nurse implement first? 1. Assess the client's apical pulse and blood pressure. 2. Auscultate the client's bowel sounds. 3. Notify the healthcare provider immediately. 4. Reinforce the dressing with a sterile gauze pad. 56. The nurse is preparing to hang a new bag of total parental nutrition on a client who has had an abdominal perineal resection. The bag has 2000 ml of 50% dextrose, 10 ml of trace elements, 20 ml of multivitamins, 20 ml of potassium chloride, and 500 ml of lipids. The bag is to infuse over the next 24 hours. At what rate should the nurse set the pump? Client name, TR. Height, 5'8". Date, today signature/initials account number, 594-8726. Weight in pounds, 202 medication Lomotil 1 or 2 tablets after each stool up to 8 in 24 hours Ondansetron 4 to 8 mg IVP every 4 hours PRN for nausea allergies, milk date of birth, July 22, 1948 0701 to 1500 09000630, 4 mg. 1230, mg. Day Nurse RN/DN 2301 to 070004000030, 4 mg. Night Nurse RN/NN 1501 to 2357. The unlicensed assistive personnel, UAP, tells the nurse a female client, who had a laparoscopic cholecystectomy, is complaining of abdominal pain. Which intervention should the nurse implement first? 1. Check the medication administration record for the last pain medication the client received. 2. Instruct the UAP to ask the client to rate her pain on a 1 to 10 pain scale. 3. Assess the client to rule out any postoperative surgical complications. 4. Tell the UAP to obtain the client's vital signs and pulse oximeter reading. 58. The male client is 30 minutes post-procedure liver biopsy. Which action by the unlicensed assistive personnel, UAP, requires the nurse to intervene? 1. The UAP offered the client a urinal to void. 2. The UAP gave the client a glass of water. 3. The UAP turned the client on the left side. 4. The UAP took the client's vital signs. 59. The client diagnosed with liver failure is experiencing pruritus secondary to severe jaundice and is scratching the upper extremities. Which intervention should the nurse implement first? 1. Request the UAP to assist the client to take a hot, soapy shower. 2. Apply an emollient to the client's upper extremities. 3. Place mittens on both hands of the client. 4. Administer Benadryl 25 mg po to the client. 60. The client with hepatitis asks the nurse, "Is there any herb I can take to help my liver get better?" Which statement is the nurse's best response? 1. You should ask your healthcare provider about taking herbs. 2. Milk thistle is a powerful oxidant and promotes liver cell growth. 3. You should not take any medication that is not prescribed. 4. Why would you want to take any herbs? 61. Which task would be most appropriate for the nurse on the GI unit to delegate to the unlicensed assistive personnel, UAP? 1. Request the UAP to draw the serum liver function test. 2. Ask the UAP to remove the nasogastric tube. 3. Tell the UAP to empty the client's colostomy bag. 4. Instruct the UAP to assist the unit secretary to transcribe HCP orders. 62. The client is diagnosed with gastroenteritis. Which laboratory data warrants immediate intervention by the nurse? 1. A serum sodium level of 152 milliequivalent/L. 2. An arterial blood gas of pH 7.37, PaO 295, PaCO 243, HCO 324. 3. A serum potassium level of 4.8 milliequivalent/L. 4. A stool sample that is positive for fecal leukocytes. 63. Which nursing problem is the highest priority for the client diagnosed with gastroenteritis from staphylococcal food poisoning? 1. Fluid and electrolyte imbalance. 2. Alteration in bowel elimination. 3. Nutrition, altered, less than body requirements. 4. Oral mucous membrane, altered. 64. The nurse has received the AM shift report. Which client should the nurse assess first? 1. The client with peptic ulcer disease who is complaining of acute epigastric pain. 2. The client with acute gastroenteritis who is upset and wants to go home. 3. The client with inflammatory bowel disease who is receiving total parenteral nutrition. 4. The client with hepatitis B who is complaining and who is jaundiced and anorexic. 118. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 65. The client who has had abdominal surgery is complaining of pain and tells the nurse, "I felt something pop in my stomach." Which intervention should the nurse implement first? 1. Check the client's apical pulse and blood pressure. 2. Determine the client's pain on a 1 to 10 pain scale. 3. Assess the client's surgical wound site. 4. Administer pain medication intravenously. 66. The client who is 2 days postoperative abdominal surgery has a hemovac drainage tube. Which assessment data indicates the Jackson-Pratt, JP, is functioning appropriately? 1. The hemovac is round and has 40 ml of fluid. 2. The drainage tube is pinned to the dressing. 3. The hemovac insertion site is pink and has no drainage. 4. The hemovac has suction and is compressed. 67. The nurse is caring for the following clients on a surgical unit. Which client should the nurse assess first? 1. The client with an inguinal hernia repair who has a urine output of 160 ml in 4 hours. 2. The client with an emergency appendectomy who was transferred from PACU. 3. The client who is 4 hours postoperative abdominal surgery who has flatulence. 4. The client who is 6 hours post-procedure colonoscopy and is being discharged. 68. The client who is morbidly obese is 8 hours postoperative gastric bypass surgery. Which nursing intervention is of the greatest priority? 1. Instruct the client to use the incentive spirometer. 2. Weigh the client daily in the same clothes and at the same time. 3. Apply sequential compression devices to the client's lower extremities. 4. Assist the client to sit in the bedside chair. 69. The charge nurse has completed report. Which client should be seen first? 1. The client diagnosed with ulcerative colitis who had 5 loose stools the previous shift. 2. The elderly client admitted from another facility who is refusing to be seen by the nurse. 3. The client with intractable vomiting who has tented skin turgor and dry mucous membranes. 4. The client with hemorrhoids who had spotting of bright red blood on the toilet tissue. 70. The nurse, a licensed practical nurse, LPN, and an unlicensed assistive personnel, UAP, are caring for clients on a medical floor. Which nursing task is most appropriate to assign/delegate? 1. Instruct the UAP to discontinue the client's total parenteral nutrition. 2. Ask the UAP to give the client 30 ml of Maalox for heartburn. 3. Tell the LPN to administer a bulk laxative to a client diagnosed with constipation. 4. Request the LPN to assess the abdomen of a client who has had complaints of pain. Questions Chapter 5 Gastrointestinal Management 119-120 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam MS. Kathy is the charge nurse on a 36-bed unit that admits clients with gastrointestinal disorders and gastrointestinal surgery. The unit is staffed with 4 RNs, 2 LPNs, and 2 UAPs as well as a ward secretary. 1. Ms. Kathy is making assignments. Which client should be assigned to the graduate nurse who has been on the unit for 1 month? 1. The client diagnosed with lower esophageal dysfunction who is complaining of pyrosis. 2. The client who had an endoscopy this morning and has absent bowel sounds. 3. The client with gastroesophageal reflux disease who has bilateral wheezing. 4. The client who is 1 day post-op open cholecystectomy and refuses to deep breathe. 2. The client diagnosed with inflammatory bowel disease has a serum potassium level of 4.4 milliequivalent/L. Which intervention should the nurse implement first? 1. Notify the healthcare provider. 2. Continue to monitor the client. 3. Request telemetry for the client. 4. Prepare to administer potassium. 4. 3. The client has been admitted to the hospital with hemorrhaging from a duodenal ulcer. Which independent interventions should Ms. Kathy instruct the primary nurse to implement? Select all that apply. 1. Complete the admission assessment. 2. Evaluate BP lying, sitting, and standing. 3. Administer antibiotics intravenously. 4. Administer blood products. 5. Obtain a hemoglobin and hematocrit. 4. Ms. Kathy is discharging a client with a new sigmoid colostomy. Which statement made by the client indicates to Ms. Kathy the client needs more teaching? 1. If my stoma becomes a purple color, I will notify my HCP. 2. I can eat the foods I used to eat when I go home. 3. I should wear a colostomy pouch over my stoma. 4. I will irrigate my colostomy every week with 750 ml of tap water. 5. The nurse is preparing to hang a new bag of total parental nutrition on a client who has had an abdominal perineal resection. The bag has 2000 ml of 50% dextrose, 15 ml of trace elements, 30 ml of multivitamins, 20 ml of potassium chloride, and 200 ml of lipids. The bag is to infuse over the next 24 hours. At what rate should the nurse set the pump? 6. The client is admitted to the medical unit with a diagnosis of acute diverticulitis. Which order should Ms. Kathy clarify with the healthcare provider? 1. Insert a nasogastric tube. 2. Start 4D5W at 125 ml/hr. 3. Schedule the client for a sigmoidoscopy. 4. Place the client on bed rest with bathroom privileges. 7. Ms. Kathy observes the unlicensed assistive personnel, UAP, turning the client who has just had a liver biopsy to the supine position. Which action should Ms. Kathy implement first? 1. Tell the UAP to keep the client on bed rest for 2 hours. 2. Praise the UAP for placing the client in the supine position. 3. Instruct the UAP to place the client on the right side. 4. Complete an incident report on the UAP's behavior. Gastrointestinal Clinical Scenario Chapter 5 Gastrointestinal Management 121-8. One of the primary nurses tells Ms. Kathy she stuck herself in the finger with a used needle and cleaned the site with soap and water. Which intervention should Ms. Kathy implement first? 1. Notify the infection control nurse. 2. Complete an adverse occurrence report. 3. Request post-exposure prophylaxis. 4. Check the hepatitis status of the client. 9. Which nursing task is most appropriate for Ms. Kathy to delegate to the unlicensed assistive personnel, UAP? 1. Bathe the client with liver failure who has a Sengstaken-Blakemore tube inflated. 2. Teach the client with an open cholecystectomy to splint the incision when coughing. 3. Assist the client with pruritus to the bathroom for a shower and AM care. 4. Tell the UAP to assist the nurse performing a paracentesis on the client with liver failure. 10. Ms. Kathy is making rounds on the unit. Which client should Ms. Kathy assess first? 1. The client diagnosed with peptic ulcer disease who is receiving blood and has a hemoglobin of 10.1 and hematocrit 35. 2. The client diagnosed with ulcerative colitis who has had 10 loose stools and has a potassium level of 3.5 milliequivalent/L. 3. The client who is 1 day post-op abdominal surgery with a hard, rigid abdomen and elevated temperature. 4. The client diagnosed with acute diverticulitis whose nasogastric tube is draining green bile. 122. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. This client should be seen in a timely manner, but not before the client who is vomiting. 2. This can take some time and should not be hastily completed because the nurse must know the task is being done correctly before delegating it to a UAP. This should be done at a time arranged between the UAP and the nurse. 3. This client has experienced a physiological problem and the nurse must assess the client and the emesis to decide on possible interventions. 4. The nurse could call the extended care facility after assessing the client who has vomited and after dressing the client's leg. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, analysis. Making nursing decisions, the test taker should use some tool as a reference to guide in the decision-making process. In this situation, Maslow's hierarchy of needs should be applied. Physiological needs have priority over psychosocial ones. 2.1. A barium study of the upper GI system is an X-ray procedure and does not require the client to sign an informed consent form. 2. The barium can cause constipation after the procedure, therefore, the client should increase fluid intake, but this is not the priority intervention. 3. The client will have to drink a white, chalky substance, but the priority intervention is to make sure the client is NPO. 4. The test is a barium study of the upper GI system and requires the client's upper GI system to be empty. This client should be made NPO at least 8 to 10 hours before the test. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis. Making nursing decisions, the nurse must be knowledgeable of diagnostic IC tests. The nurse must know pre-procedure and post-procedure interventions, as well as which ones require informed consent. Remember, with the gastrointestinal system, being NPO is often the priority intervention. 3.1. The nurse would expect the client with dyspepsia, upset stomach, to have eructation, belching, and bloating, therefore, this client does not warrant immediate intervention. 2. The nurse would expect the client with pancreatitis to have steatorrhea, fat, frothy stools, and pyrexia, fever. Therefore, this client does not warrant immediate intervention. 3. The nurse would expect the client with diverticulitis to have left lower quadrant pain and fever, therefore, this client does not warrant immediate intervention. 4. The client with Crohn's disease should be asymptomatic, so pain and diarrhea warrant intervention by the nurse. Pain could indicate a complication. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis. Making nursing decisions, warrants immediate intervention means th. A nurse must determine which client is priority to assess. The nurse would assess a client in pain if all the other options had clients with expected signs/symptoms. 4.1. The nurse should not delegate to the UAP feeding a client who is not stable and at risk for complications during feeding, as a result of dysphagia. This requires judgment that the UAP is not expected to possess. 2. UAPs can change linens for clients who are incontinent. Therefore, this task could be delegated to a UAP. 3. The UAP can assist the client to the bathroom and document the results of the attempt. 4. The UAP can obtain the vital signs on a stable client. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Answers and rationales. Making nursing decisions, an RN cannot delegate assessment, teaching, evaluation, medications, or an unstable client to a UAP. Tasks that cannot be delegated are nursing interventions requiring nursing judgment. 5.1. The client diagnosed with acute diverticulitis should be NPO, therefore, the UAP should not feed a client. This action does not warrant immediate intervention. 2. The UAP should not allow the client on bed rest to use the bedside commode, therefore, this does not warrant immediate intervention by the nurse. 3. A client with a continuous feeding tube should be in the Fowler's or high Fowler's position to prevent aspiration pneumonia. This action requires immediate intervention by the nurse. 4. The UAP can place sequential compression devices on a client. Therefore, this does not warrant immediate intervention. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, Cognitive level, synthesis making nursing decisions, delegation means the nurse is RESP.